After more than a year of tough negotiations, we arrived at a tentative agreement with the government on the sectoral matters on December 5th. And it is not just any agreement. It is an agreement that adheres to our priorities on all levels, priorities that you, the members of the FIC, had set. This agreement, it is yours. First, I want to thank and congratulate the negotiation committee and the coordination of the negotiations and the FIC Info support team. They did an extraordinary job throughout the process. They always worked to make sure your interests were respected. They worked tirelessly to be able to wrench the most possible from the government for the good of healthcare professionals. They did this always keeping in mind the priorities of that we were given. I say to them, hats off to you. All of this would not have been possible without your mobilizations. Our actions were decisive in the result. On December 8th and 9th, the delegates, meeting in a special Federal Council, closely studied the agreement. At the end of those days of study and analysis, they make the choice to approve it and to submit to you for adoption. Therefore, you will be asked to vote on it. We will outline here the main principles and the main gains in this agreement. Major and remarkable gains for all healthcare professionals.
Approached by the other labor organizations to form a common front, the FIC decided to conduct its sectoral negotiations alone, convinced that the determination of the 66,000 members would succeed in finding the solutions to the problems that the nurses, licensed practical nurses, respiratory therapists, and clinical perfusionists encounter. And we believe that it was the best choice, the most profitable choice. The results speak for themselves. If you adopt it, this agreement will enable us to put in place the innovative solutions for the improvement of your working conditions. It will also improve the quality and the safety of the care for the population. The priorities of the negotiations, which the members of the FIC adopted, covered a reduction in the workload, a reduction in job insecurity, an improvement of the working conditions, and the recognition and enhancement of training education. Following the passing of Bill 10, a fifth priority was added to eliminate the harmful consequences of this law. The government had to be forced to recognize the deterioration in the workplaces, and we believe we have succeeded. Among the most important gains, the upgrade in the rate of full-time positions marks a major advance. Thus, the provincial target will increase the rate of full-time positions by the end of the collective agreement, from 50% to 62% for the nurses, from 34% to 50% for the licensed practical nurses, and from 45% to 54% for the respiratory therapists. This measure will result in a reduction in job insecurity, particularly for licensed practical nurses, many of whom are presently confined to positions of 4 shifts per 2 weeks. Another important breakthrough is the setting up of pilot projects to establish healthcare professional-to-patient ratios. These projects will make it possible to evaluate the relevancy and the feasibility of healthcare professional-to-patient ratios, thus reducing the excessive workload while improving the quality of patient care. To ensure that the agreement is respected and implemented, a provincial joint committee will be created in the 60 days following the signature of the collective agreement. An annual evaluation of the evolution of the targets will be done by the committee by taking into account certain indicators. 13 years after it was passed, we have obtained from the government that it will apply Bill 90 in full. That will enable us to carry out our entire scope of practice. To accomplish this, the nurses with a college diploma will be offered an update on the assessment of the physical and mental condition of a user. This progress has enabled us to obtain a change in the salary ranking, which we will talk about a little later. The updating, or the professional improvement, will be paid and done in a hybrid manner. either on work time or outside work time. We have negotiated several salary improvements for healthcare professionals in the agreement we are presenting to you. We succeeded in making a significant breakthrough for establishing another level of critical care, the operating theatre, including the recovery room and the obstetrical theatre, and in hemodynamics. Thus, all the healthcare professionals who work in critical care will receive the critical care premium of 6% and the enhanced premium of 7%. There will be another level for the clinical perfusionists, which specifically applies to them. We have also obtained the full recognition of the shift overlap period for the licensed practical nurses who work in the CHSLD. Not to mention that we came to an agreement with the government on the payment of a lump sum on an individual basis for the employees who work with the patients in the CHSLD. We are particularly happy to be able to announce the creation of a provincial committee to analyze the problems of attraction and retention of the employees who work in the territory covered by the old C3S Haute-Côte-Nord Manicouagan. There are serious problems which can be resolved, and measures will be applied to keep and attract healthcare professionals in the region. We also reached an agreement with the government on the importance of addressing the problems of attraction and retention of specialty nurse practitioners. Therefore, there will be an addition to the mandate of the Provincial Joint Committee on the task and organization of work, which must document the issues related to their continuing education as well as their working conditions. We are particularly proud to have reached an agreement with the government that at the signature of the collective agreement, the nurses with a Bachelor of Science in Nursing will automatically have their education recognized. The same exercise will be done on April 1st, 2019. We have forced the government to make concessions to offset the negative effects of Bill 10. Whether it is the transfer zones, reassignment, the home base, or job security, several measures will be put forth to respect the rights of healthcare professionals, in particular by preserving the radius of 50 kilometers. Lastly, and in order to better recognize the work of healthcare professionals, we have concluded an agreement with the Treasury Board on a change in the salary ranking for healthcare professionals. This is a substantial and major gain. If you accept this agreement with the changes of ranking, with the relativity and the salary increases, the remuneration of healthcare professionals will be significantly increased over the term of the collective agreement. The increase could be more than 12% in certain cases, and this without including the different premiums.
We believe that we were able to get the most that we could in the interest of the healthcare professionals. These are major gains that you may benefit from. This is not a complete presentation. It is a summary on the main elements. We invite you to contact your local teams for more information and specifics. This agreement, it has been negotiated by you and for you. In the coming days and weeks, you will be called upon to decide on the tentative agreement. It is with pride and conviction that we invite you to vote for it. Thank you.
Merci.
Merci.